Back, my dear students, to another part of our PSW studies. We'll go to another part right now, and we'll go to something newly for everyone. Just share the screen. So here we will talk about something very important for our work as PSW, to know the differences between the negligence and malpractice. What's the differences between negligence and the malpractice? The difference between both of them. Difference between the negligence and the malpractice in the healthcare services. And this is also very important part because it shows how far we are aware of the differences between both of them, between the negligence and malpractice. And actually, I hope that the Wi-Fi is working well. As I see here, it's not that enough. Hopefully, it will help me to finish what I want. So the PSW students must understand the differences between negligence and malpractice, which is crucial for us to provide. So what is the negligence? Negligence is general term that refers to the failure to provide the reasonable care and lead to harm. So I didn't give care enough, and that leads to the harm of the patient. The patient is sick, the patient is not in a good situation, the patient is complaining, and so on. But in the healthcare context, medical negligence occur when medical provider, look at this, when medical provider fail to fulfill their professional duties. They didn't do their duties as they're supposed to do, just as misdiagnosis or improper treatment. So here again, I would say negligence is the general term that refers to the failure to provide the reasonable care and lead to harm. In the healthcare context, medical negligence occurs when medical providers fail to fill their professional duties, such as misdiagnosis or improper treatment. Okay. When medical negligence directly causes the harm that the patient should be compensated for, it becomes medical malpractice. Again, when medical negligence directly causes the harm that the patient should be compensated for, it becomes medical practice. So the distinction is important for not only healthcare, but also for professionals to ensure accountability and productivity as well of the healthcare services. So let's see the negligence again. Again, we are saying the negligence. Here we go. Negligence happens when someone does not take reasonable care. I don't care. He's having a fever. I ignored. His situation became worse. The patient, I mean. So I didn't report to my own leader or to my own nurse or to my own supervisor about his situation right now. These are all examples for the negligence. Type. These types of negligence include gross negligence. This is the first one. We call it gross negligence. So what is this and what's the gross negligence is? Extremely careless. This is extremely careless behavior. He doesn't care at all. He or she doesn't care about the patient. Absolutely, they don't care about it. Comparative negligence. So this is what? It's not like the gross, but still negligence as well. The plaintiff also contributed to their own harm, affecting compensation. Compensation means that you have to do what's supposed to be done to the patient. Okay, negligence per person or rule. This means breaking a law or a regulations automatically counts as negligence. So if as example, let's say that the smoking is very harm for the patient, and you are sitting in front of the patient and you smoke, this is a big problem. As PSW, negligence can be the following: failing to provide proper care, ignoring the client's needs, not following safety protocols or procedures, not reporting incidents to concern. These are the things which means the negligence. Again, I would say here, again, I would say it. So negligence for a PSW, like include the following. We said we have gross negligence, comparative negligence, and we have negligence due to breaking the law or breaking the policies or overwhelming the acts or whatever. Okay, as a PSW, negligence can be of the following: failing to provide proper care or supervision. This is the first one. Second, ignoring clients' needs. Third, not following safety protocols or procedures. Four, not reporting incidents or concerns. Like we said before, when something happened, you have to report it to your nurse or to your supervisor directly. If you find any change in the patients, if you find any problems with the patient, you have quickly to inform your boss about it, your supervisor about it. Malpractice. Let's see now. We talk about the negligence and we said this is like a duty of care is less or is not there. But what about the malpractice? Malpractice happens when a professional does not live up to the standards of their field, causing harm or injury to a client or a patient. Types of malpractice. Again, the malpractice happen when a professional does not live up to the standards. He doesn't go to the standards, like he doesn't do the job as it's supposed to be. He doesn't, it's not negligence, but he doesn't do the job as it's supposed to be, causing harm or injury to a client or a patient. This is another, okay. Types of malpractice. What are those types of malpractice? Like what? Medical malpractice, a healthcare professional's negligence, or error diagnosis. As example, for the medical malpractice, if I did error in diagnosis for the patient, I saw a patient, he's having a pain in his stomach on his right side abdomen. Then I told him, no problem, this is just pain because of your colon, and that's everything, while it was appendix. So I made a mistake here in the diagnosis. Or someone come to me with a tumor or whatever. I said, it's okay, this tumor looks like it's benign tumor. You don't need to go for a check or for a lab test or for blood taken. This is another problem because here you made a mistake in the diagnosis itself. And the treatment, you give people or patient wrong treatment, or you didn't give enough care as it's supposed to be. So these are all examples for medical, like we said, medical malpractice. Second one is professional malpractice. Professional malpractice. So what about the professional malpractice? A failure to meet professional standards, resulting harm or injury to the client or the patient. So here, you don't follow the professional standards. You don't follow the professional standards, and that leads into a problem happen to the patient, your patient. As a PSW, malpractice might include the following: negligence, failure to provide proper care, abuse, physical, emotional, or financial abuse to the client, misconduct. So these are so that for the PSW here, we're talking about the PSW here. He might be involved in the mispracticing as one of those feelings right now, like he has a negligence, which failure to provide proper care or supervision, abuse, like physical, emotional, or financial abuse of a client, misconduct, unprofessional behavior, such as breaching confidentially or engaging in inappropriate relationship with the client, having an inappropriate relationship with the client. This is also misconduct. We call it misconduct. So we have negligence, abuse, and misconduct. We have also gross negligence. We talked about it before, like severe and reckless disregard for a client's safety or well-being. I don't care Totally, I don't, totally, 100%, I don't care about the client. I don't care about his needs. In that case, we call this gross negligence. Again, the PSW might go within one of those categories. The negligence itself, abuse also. He might do abuse to the client. He might behave in a misconduct, like breaching confidentially, giving the secrets of the client to the others, or like unprofessional behavior such as breaching and engaging in appropriate relationship with the client, to have inappropriate relationship with the client. Gross negligence, when he totally don't care about the client, when the PSW does not care totally about his client. Here, this is gross negligence. Okay, just a few words. In a few words, negligence can apply to anyone. Anyone can be exposed to do a negligence, but the malpractice is related to the professional. Malpractice is related into professional more, such as doctors, accountants, and attorneys. So the malpractice goes with the professionals, but the negligence goes to anyone, because negligence seeming, yeah, it is like losing the duty of care. Might be gross means totally, and it might be not gross like that way. طيب. As example of the negligence, as example to illustrate, a driver run a stop sign and slams into another car is example of negligence. While giving the wrong dose of drugs, or anesthesia during an operation is an example of the malpractice. Like you see here, in the malpractice, it's more professional. Malpractice is more professional, but negligence, anybody can do it. Anyone can get out of the duty of care. So it's not, the negligence is not related to professional. The negligence is not related to professional, but the malpractice is about a doctor or a lawyer or a teacher even. This we call it malpractice. So negligence is carelessness, like we see here. But malpractice is professional. Like I said before, malpractice is professional. And this is the difference between them. It is a professional negligence. So like if I'm not stuck to standards, I'm not doing the work as supposed to be, then this is, we call it malpractice. For a PSW, you must avoid making the mistakes of negligence or malpractice, as it can lead into big problems, severe sequences or consequences for the clients. It is essential to understand the negligence and prioritize professionalism. Always be professional. Always be professional to avoid multi-practice, because we said that the multi-practice is professional, and we say that the negligence is not professional. It is kind of carelessness, I will come here right now into a new part or a new question. I will ask you guys about here is the design. I don't want this specs, and I don't want this frames as well. I don't need these frames, and I have to ask a question here. Compare between negligence and compare between negligence and malpractice. And malpractice. This question is here, like we said, the answers. Let me just review you the answers back. Compare between negligence and malpractice. Let me just review the answers with you right back so that you know what you are doing. Compare between negligence and malpractice. Negligence is about breaching the duty of care. You don't care too much and so on. But malpractice is professional more. You don't care about the way you have to do the work, about the contents of the work, about your duties and something. Malpractice can happen to engineers, doctors, lawyers, but negligence can happen to anyone. Can happen to anyone. And we talk about this point. Shall stay here for around 5 minutes to get your answers. You can also Google search for more details if you need to know the differences between the negligence and malpractice. We'll stay here like around 5 minutes to get your answer, guys.